Hundreds of communities in our country don't have enough doctors. Some don't have a single one. Our national investigative team analyzed the federal data to see where communities are left without care. Investigate TV's Lee Zurik looks at the problem and those who are bridging the great health divide.
In a healthcare desert that's the hometown of a 9-time Grammy Award winner,
it's a simple country town.
Families rely on one person, pediatrician Andrew Beach, to keep their kids healthy.
Dr. Beach saved my son.
He saved your son's life?
Yes, my daughter wouldn't be here today without Dr. Beach.
In the southeast Missouri town of Kennett, Beach is the only pediatrician around.
The closest pediatrician's about 40 minutes away.
Sarah Bellamy's 9-year-old son has a rare disorder, acute flaccid myelitis, a neurological condition that has him on a ventilator.
Where does it hurt? Huh?
In 2016, a health scare sent Bellamy and her boy to Beach's office. Beach looked at this video. His medical opinion, the Bellamys needed to leave town immediately. He sent them 2 hours away to the nearest children's hospital. That advice, life-saving.
What would have happened if he would have waited?
He would have died. Because Hayden, was pretty much in respiratory failure.
Beach says he sees on average about 50 patients a day.
I want to say the yearly is about 14,000 visits.
You see 14,000 patients a year?
Yeah.
There's no way.
Yeah. Me with 2 nurse practitioners now.
There's a doctor shortage.
Yeah, definitely. We used to have cardiologists, ENTs, we used to have orthopedics, we used to have all those things.
Now, Kennett, Missouri has no specialists and only a few primary care doctors. Our investigation has uncovered more than 1,000 counties across the country might be worse off than Dunklin County, Missouri, where Kennett is located. We analyzed government data that tracks primary care doctors. The dire conclusion of our analysis, these counties in red on the map are designated as shortage areas. They don't have enough primary care doctors to care for their populations. More than a quarter of those areas are in the Delta and Appalachian regions. You'd need nearly 600 doctors just in those areas to fix the shortage.
Overall, if you have people that don't have access to health care, then they wind up having worse outcomes.
When the Kennett, Missouri hospital closed, residents worried their only pediatrician would leave town.
Why do you stay?
My heart was in rural medicine to start with.
Beach's decision to stay was noteworthy enough to make the county newspaper. As Sarah Bellamy found out, that decision could be the difference between life and death for thousands of kids in her community.
So if he left, you would have to drive 45 minutes to an hour to get to a pediatrician.
Just for normal everyday stuff.
That's how valuable he is to this community.
Yes. Very much so.
Lee Zurik, Valley News Live.
The U.S. government estimates more than 15,000 doctors would be needed nationwide to eliminate the current shortages.